All right, so we're now going to go ahead and transition into our alumni panel. I'm so excited to be joined by our amazing panelists today. And I will be saving about 10 minutes at the end of the questions so that you all can ask your own questions. If you can't come up with any, I have more. So, but just know that if you do have questions, please save them till the end. So we're going to go ahead and get started with introductions. If you could please share your name and pronouns, if you would like to, your degree program and grad year, and in 1 to 2 sentences, what do you do and what motivates you to keep doing it? And I'll start with you, Paige.
Hi, I'm Paige Cruza. I graduated in 2014 and currently for 7 years now. I've been working at a small consulting firm that works with mostly local public health agencies and some nonprofits and occasionally other government agencies to provide evaluation, assessment, and strategic planning services and support for different programs related to health and health policies and racial equity. And I keep doing it mostly because it's really fun. I have a really great team and get to do a lot of different things, from data crunching the numbers to mapping to facilitating and writing and all the rest. Oh, sorry, health and social policy, health and social behavior. I haven't been here for a while, so yes, health and social behavior.
Hi everyone, my name is Gene Ho. I go by he, him, his pronouns. I graduated in 2020 with my MPH, but I am a double bear, so I did my undergrad in 2019, also in public health, but my MPH is in epibiostats. Right now I'm a quantitative data analyst at Flatiron Health, which is a real-world data company that works with cancer patient data. And what motivates me to keep doing it is I just like seeing the impact that I can do. We influence cancer care, and I've always wanted to work in the oncology space. Thanks.
Hi, my name is Jacqueline Ferguson. I go by Jackie. I use she, her pronouns. I graduated in 2019, December, from the PhD program in environmental health sciences, so I got out right in time. I did start a job working for the U.S. Department of Veterans Affairs, so that went well. I got a key to my office and they were like, go home. But I am a health services researcher. My views do not represent the United States government. I really love what I do because I love really complicated problems, and our government is anything but non-complicated. And I work every day trying to improve the way veterans are accessing healthcare.
Hello everyone, my name is Elizabeth Lee, she, her pronouns. I'm also a double bear, graduated undergrad in 2010 with public health, and then again in 2019, Yeah, 2019, sorry. 2019 with an MPH in maternal, child, and adolescent health. I'm currently a senior policy consultant at the Aware Health Group. It is a mission-driven consulting firm. Most of our clients, we have a wide variety of them, but I would say the bulk of our clients are the California Department of Healthcare Services, DHCS, gotta try not to use acronyms. I do a lot of work with the federal grants branch team around mental health grants and substance use disorder grants, and help do services for our clients with project management and program implementation.
Awesome, thank you all. So I think I'm actually gonna have everyone answer this question, but if you could maybe try to keep it to a couple minutes, because I know with these types of questions, it can be easy to want to tell your whole life story. So take a couple minutes to describe your journey to your current work. How did you get here, and how did your public health training at Berkeley play a role? So maybe we'll go backwards. Elizabeth, I'll have you start.
Yeah, so my public health journey is really interesting, especially in the last couple of years. After graduating Berkeley undergrad, I went into the reproductive healthcare services field and primarily did a lot of advocacy and project management work and research coordination work in family planning, abortion, and contraception work. Did that all throughout my couple years working, did that through grad school, got a job after grad school, doing that work with an academic medical society. So we worked with physicians and researchers and helped them support their work, gave them grants, gave them places to publish, just a great society to kind of be a part of, a community to be a part of. As a lot of you probably know, the situation in the United States is not great for reproductive health care right now, and the organization ended up changing up their priorities, and I actually got laid off in about a year ago. Taking that opportunity, I tried to, was obviously devastated, but tried to take it as an opportunity to switch it up, do something different. Obviously still love public health, but wanted to try to do some work that was less research coordination focused and more into the project management field. I ended up connecting with somebody who was on the Public Health Alumni Association, which I'm currently on the board of as well, and ended up at this job at Herrera where I'm doing public health consulting. It's been really great. I use a lot of the same skills and a lot of the training from Berkeley that I got, particularly from the internship program where I worked in Hope Lab, a social innovation lab that was doing research on a app for low-income first-time mothers, and really handling that research study, project managing the kind of aftermath of the research and trying to get the data out to the folks that we're trying to serve. I use a lot of those same skills in my consulting job. So try to keep that really short, so hopefully it wasn't incoherent.
So my public health journey started in undergrad. I did both my undergraduate and my master's degree at Johns Hopkins, both the undergrad and then the Bloomberg School of Public Health. And then I joined for my PhD here at Berkeley in environmental health sciences, and really have just been led by my love for really complicated data. So I first started working in tobacco control, then I worked in a human fecal lab looking at E. coli. Then I came over and started doing work on administrative data sets, looking at shift work, and now I work in Veterans Affairs. So I just really like data. So the tools that I gained during my very heavily epi-minded PhD in environmental health really leveraged that skill set to which I apply every single problem. So some of my work in the VA focuses on how veterans are accessing virtual care throughout the entire pipeline, from scheduling to being able to log on to the system to being able to sustain a connection long enough to have a conversation with a physician. But I was also involved in some work early on in the VA trying to identify which veterans were able to get access to COVID tests, and then amongst those who were able to get a test, what was their likelihood of testing positive. And so all the projects I've been involved in have really been like, hey, Jackie, you have a skill set. I'm like, yes, I do. I like data. And they're like, okay, great. Here's funding. Go do it. And taking that adaptive and constantly learning skill set that I got here at Berkeley has really enabled me to tackle on whatever new problems I'm interested in.
Yeah, so I guess I did my undergrad here at Berkeley. I came in at pre-med probably 50% of other Berkeley undergrads. And then I found out about public health, and I was like, oh, this is actually pretty cool. I can still do good in the world. I don't have to take MCAT, stuff like that. And then I was also seeing all my friends who were CS majors, and I was like, ew, coding? But then here I am, literally coding, 30 to 40 hours a week. And it was really because of all the opportunities that were afforded to me by the public health curriculum. You have to take intro, stats classes, and I was like, oh, it's actually pretty fun. And so then I kind of found myself coding more and more, and I was like, oh, I can maybe do this for employment. And then I ended up working at the LA County Public Health Department as a data scientist and epidemiologist during the on the COVID-19 team. And then I realized this is a little bit too much coding for me. And so then I moved to Flatiron, where now we get to ask a lot of really hard data questions on how can we influence cancer patient journeys, kind of through a pharma lens. So that's sort of how I got here, being able to ask really difficult questions, having sort of the technical skills are all things that were sort of afforded to me by this Berkeley education.
Thanks. I got introduced to public health when I was in high school and got involved with queer and trans activism in Massachusetts, mostly through suicide and violence prevention, and then continued sort of that with trans rights and economic justice, interracial justice, and anti-violence work of various kinds. And so did undergrad that focused on sort of women's studies and critical race studies, and therefore got a deep sort of training in and practice in qualitative research, so ethnographic interviewing and understanding sort of what data was looking like due to historical and policy contexts. And then graduated, wanted to get some fundraising experience, so started working in a few nonprofits as a development person, so both for grants and then donor development. Moved to Oakland in 2009, which was right about the foreclosure financial crisis. So there were not a ton of jobs available, so stayed in fundraising because that was what was available for a bit. And then looked at UC Berkeley and the other public health schools in the area a few years later because I wanted to get back into public health and didn't want to stay in fundraising super long term. Ended up I did a bunch of informational interviews with alum and with some of the professors, and it seemed like the sort of network that I would get from UC Berkeley, as someone who had all of my public health experience in Massachusetts, was going to set me up sort of best for actually getting back into public health upon graduation compared to SF State or University of San Francisco at that point in time. I didn't want to leave the Bay Area. I was already pretty settled, and also really loved the flexibility that it gave me in terms of being able to take classes in city planning and in the policy school and in mapping, and so was able to get the skills that I wanted, sort of the diversity of skills, and build particularly my quantitative analysis skills here in a way that set me up then to continue doing program evaluation and sort of combining the different kinds of data analysis that I can do with some critical thinking and that sort of historic context as well of structural racism, and being able to combine all those things to try to make recommendations that will be aspirational and also actionable.
Thank you all for sharing. My next question for you all is, what surprised you the most about your time at Berkeley? It could be anything. And maybe I'll have you start, Jean. If you can answer that question.
Yeah, I think what surprised me is how nice everyone is and like how willing they are to help you. Like, I don't know, you kind of put faculty on a pedestal most of the time, right? But then it's like, oh, you actually like are able to find time and get into office hours, and like, oh, they're like really cool people who have interesting thoughts and they're actually human, right? Or like even the administration, right? Like they're also really amazing people who like really are there to help you. And I feel like I haven't gotten that vibe from like students at other schools necessarily. And then also just like the diversity of like program and like courses that you can take. Like, yes, you are going to be in the School of Public Health, but it doesn't mean you only have to take, you know, whatever classes are in your division or even just the School of Public Health. Like I took a lot of data science classes. I took, you know, classes at the School of Business. As long as you're able to finish your requirements, right? Like you're really able to take anything like anywhere on campus.
I think something that was surprising for me was how many opportunities there were to get involved in things that you care about, communities that you identify with, or just like cool, fun things to do. I found myself actually joining 3 different student groups while I was at Berkeley. I intended to come to graduate school, you know, to get my degree, maternal child health, do a lot of, you know, data heavy work, stats heavy work, and kind of really focus on the coursework and things like that. But actually found the most enjoyment out of joining the student organizations, planning events with my fellow students, talking about public health issues with them. And I've actually, you know, this is maybe surprising or maybe not surprising, but after the fact found that those connections I made at those student organizations, they were with folks outside of my cohort, folks who were studying vastly different things that I was. And they were the ones who like really came through for me when I was looking for work or when I was trying to shift my career into something else. And yeah, it's been really wonderful to be able to have that experience with other students and with the student organizations at Berkeley.
I think for me, I was really surprised by the lack of people telling you no here. East Coast mentality, people tell you no a lot. Here at Berkeley, I would have like an idea and I'm like, hey, what if we do this? And they're like, oh yeah, go for it. Here's a funding source. Or one of my pride and joy of being a Berkeley student is we noticed that there was no UC Berkeley t-shirts anywhere. And so we're like, all right, let's make some. And everyone was like, yeah, do it. And I just like contracted with a company, made a logo, like sold the t-shirts out of my office, got accused of money laundering from central office, which is not what money laundering is. And it has become the UC Berkeley School of Public Health shirt that many people here are still wearing, that is carried on by the school of the student government group for SPH. And no one told me no, except for the money laundering accusatory folks. But that's the kind of mentality that is really here, whether it's something really small as wanting to see representation literally on people's bodies, like the Haas School of Business here, who has like an entire gift shop in this building, or wanting to see a larger change in the world. What really struck me was the number of people saying, yeah, do that crazy idea, and not only telling you to do it, but letting you know how they could support you.
I had a very similar experience in terms of just having people be like, yeah, go for it, which is, I think, one of the really awesome things about being here. I do want to take questions from the audience if anyone has any. If you want to go ahead and raise your hand if you have a question for one of our alum. Yeah, sorry, I did not plan out this mic situation. If you can project, maybe, hopefully I can hear you, or, yeah. We can bring you a mic. Let's do that. Thank you, Jackie.
Hi. Okay, my question is actually for you. So I'm also thinking about the PhD program in a different division, but you're talking about having been in environmental health sciences, but then doing a lot of stuff in EPI. I'm also sort of interested in the interdisciplinary aspect of the programs, and so how did you find navigating differing interests across different divisions, and were you supported in that?
I kind of feel like there's no such thing as a PhD particular type at Berkeley, except for the 4 or 5 different required classes, and then ultimately what division your mentor is at. My program is environmental health in its title, that's what it says on my diploma, but it was really heavy epi-based, and very little biostats because they speak in math, and that's hard. So I did a lot of applied epi. I collaborated with anyone I wanted across any of the departments. So I really wouldn't let the name of a program hold you back. The most important thing is your PI or your mentor or your dissertation advisor, what department they're in. And even then, I've seen people co-mentor across different departments.
Does anyone else, for the folks who did a master's program here, do you want to speak a bit to your experiences with that? Because I feel like even at the master's level, it's similar.
Yeah, I can take that question. So when I was applying to Berkeley, I honestly had a really hard time picking between maternal child adolescent health, health policy management, and health and social behavior. There were aspects of every single program that I wanted to do and wanted to learn from. And so I ended up settling on MCAH partly because it had a pretty heavy quantitative requirement. So thought I would get the quant from there. I tried to take HSB courses as I could, health policy management courses. They didn't end up working with my schedule, but I tried really hard to make them fit. But one thing that I did do also was connect really heavily with the students in each of those cohorts. Each of them actually ended up, I was an honorary member for both of those cohorts and had a lot of friends in them. And so getting to learn what they were learning by talking about their classes, shared work. And then also you're not limited in whatever your internship requirement is. And so I ended up picking one that was MCAH focused, but it was really heavy. It was a lot of social work. I was doing a lot of relationship building, a lot of talking with folks, a lot of community building and community engagement in my internship program. And so I distinctly chose a non-quantitative focus for my internship just to get that extra experience and knowledge in a different realm.
Awesome. Any other questions from the audience?
Hi, everyone. Thanks for being part of the panel. I think if you were part of the first session, if you saw the question about what we're nervous about, I think a lot of people had talked about funding or finances. And so this might be TMI if you're willing to share, but how did you fund your education? And did Berkeley Public Health support you? And if you're a few years out, how are you doing with your loans? or if you're in the PSLF, if folks are not familiar with the public service loan forgiveness. So that's a lot of questions, but thanks for answering.
My funding situation, PhD, so I came in on one of the training grants affiliated with the Environmental Health Sciences Department, which is really the key for where your department ends up. They were paying me $22,000 a year in 2015. I think it went up by 2 or 3K every year, and then immediately after I graduated, it got much higher. But that was really hard. Honestly, the reason why I was able to finish the program because I have a husband in tech. We still had to rent a house, a condo down in San Leandro where things were affordable. It still is one of the more affordable places to live in the Bay. So for those of you that are worried about funding, it is really nice to live on the Berkeley campus, but there are a lot of really cool neighborhoods off the BART line that are equally as nice. And then I also GSI'd a couple times, which comes with like a 50% tuition remission. I did a couple jobs during the summer for a PI, so I got put on their grants as like a research assistant. And so I was picking up little bits here and there.
Finances were a really big concern for me as well. I worked for a few years in between graduate school and undergrad, partly to save money for graduate school. I was lucky enough to get the block grant my first semester, so that covered, it was about $13,000 total, and then had no other funding opportunities after that in terms of what was in my initial package. It was really important for me to be able to graduate as close to debt-free as possible, and in order to do that, I actually worked quite a lot. Most semesters I worked 20 hours a week, and one semester I worked 30 hours that week, or 30 hours a week. I really don't recommend working more than 20 hours a week if you can help it, and even that is quite a lot. So I also got a GSI position, which covered 10 hours. I don't know if the positions are different now, but at least when I was a GSI, it actually covered all of tuition and your healthcare. So all you had to pay for that semester was your professional degree fee, which was around like $5,500. So yeah, working a lot in order to pay off just as much of the tuition as I could. My partner was a PhD student at the time, and so he was making like $33K. We were really bootstrapping it, but really the work was what helped fund my education. And there's a lot of students who do end up working 10 to 20 hours a week. Almost all my friends did. So it's something that you can do, and it would help fund your education. And I actually found that work experience to be really helpful in getting a job post-graduation.
Also, Biden paused my loans. So that's been really, really helpful. Yay, one thing from the pandemic that's good.
Kind of seconding what Elizabeth and I guess Jackie said too, GSIing, 25% covers most of your, or a good chunk of your tuition. I would also not recommend going over 20 hours a week unless you're really, really dedicated, but it is very taxing. I was at 30 hours a week one semester and that was awful. But yeah, I was actually able to graduate debt-free, primarily because I did a lot of GSI work. I worked over the summer, and then also had a student assistant position that was pretty nice. So there are a lot of opportunities here on campus if you kind of put your feelers out. The important thing is for GSI positions specifically is look a lot earlier than you think. So start asking professors now. If you're interested, because then you'll have at least some funding secured for the fall.
Fourth for the GSI positions. I wish I had found one the first year, and I think I got one. I got my first one second year because I'd sort of hoped that I'd be able to get within the public health school, and realized that weren't the positions available, and I didn't have the sort of pre-public health work to be able to have that make it make sense. So I ended up reaching out to some of the women's studies professors since that was my undergrad, and then that was a good connection. So that was super useful, both for funding and then also to get a better sense of what UC Berkeley undergrads were doing and what their writing was, which was very different than what I'd expected. So it was also just useful for my later work to sort of scale my expectations for folks that I worked with.
Any other questions? We have one back there, and then we'll take the question here in the corner after.
did you find your mentor and PI, and what does that relationship look like?
Okay. I cold called across multiple schools, people that I thought would be interesting to work with based off of my interest, and then had conversations with them. So I picked my mentor of my dissertation, Ellen Eisen, based off of a phone conversation where she just called me. And we just spoke for like 20 minutes, and we had a really good connection. And her mentorship style and her way of communicating matched with mine. I cannot overly emphasize that. It needs to be someone who matches what you need. Like, for example, my mentor style might not be appropriate for some other student, but I thrived under it. And I especially thrived under her team, like Sadie Costello and Sally Chodo, were the really great mentors of my dissertation. The people that she surrounded herself with, and therefore I surrounded myself with, helped me be beneficial and succeed. And where my mentor lacked, I found other people to fill that gap. Just like your relationship or your family, not everybody can be everything to you all at once. You need to find a cluster of people at the school. Maybe you have a mentor that's just for financing. You have another mentor that's for your career development. You can have multiple. Don't try to find only one person.
I think that was the answer, Jackie. Let's take the question over here, and then we'll close out.
As someone who loves public health, but I don't know necessarily what I want to do after that, job-wise, how did you feel supported in kind of navigating that market? And for example, I'm in the maternal and child health concentration, and I know I want to do more quant work, and would just be curious and how you felt supported getting jobs and everything.
Yeah, job hunting is rough, but the school does a really great job of connecting folks with, I think just being able to ask folks, the staff, the current students, alumni. Most of what I was able to figure out was actually just having informational interviews with people, asking if I could have 20, 30 minutes of their time, talking to them, and then always asking at the end, do you have anyone else you think I should talk with? And just kind of snowballing from there, making connections with folks. I think in terms of not knowing what I wanted to do, I went into grad school with the idea that I was going to be a reproductive health researcher. I came in here with that one singular purpose. Quickly learned in my first year that that is not what I want to do with my life. And so had to kind of pivot and figure out kind of what I wanted to do, or at least the direction that I wanted to go. And that's kind of how I go about things nowadays. It's just, let's pick a direction and head in that way, and we can always change course if we need to. Take opportunities to explore, use your internship for something that you may not consider doing. I purposely tried to find working with a tech company or somebody who was not strictly public health, not an academic research center, just to explore what that would look like. And that really opened up to me oh, I really like working in non-academic settings and working in that kind of space. So yeah, explore what you can. It's a journey, and you'll end up getting to some place that you like, but just having a direction is what I would recommend.
There are listservs. They send them out every week, at least, especially in the Department of EHS, Environmental Health Sciences. Liza Lutzker puts together a list of all the opportunities that anyone emails her, and they've always got really great job opportunities. I think there's a similar one in EPI. I'm not sure about the other departments, but I'm sure they follow the same suit. Work for the government. It's pretty great. I work from 8:30 in the morning to 5 p.m. and no one emails me after 5:03. No one emails me on the weekend, and I do the exact same intensity of rigor as an academic faculty appointment for more money.
Also, shout out to the Career Center. I don't know if there are folks here. Woo! Yeah, super helpful. Also really nice folks. I panic emailed them a lot during my first career search because it was COVID. But yeah, we used them.
Definitely also the informational interviews and connections, sort of having some idea of even if you don't know the kind of job or the place you want to work, having sort of a sense of these are the things that I want to do, or the things that I am really good at versus the things that maybe I don't want to have as much of my job responsibilities be focused on is useful. And then just not being a little bit uncomfortable with, being comfortable with uncertainty. So like when I got out, I had done a bunch of sort of job prep, hadn't felt like something that was sort of an amazing fit. Ended up getting a contract position for San Francisco BPH, doing the kind of work that I wanted to do that was sort of, I think, like 6 to 7 months, with the possibility of longer. The possibility didn't end up working out because the funding didn't happen. But then through other connections, right, and through networking, ended up getting another temporary 1-year position at Alameda County DPH. None of these temporary positions had holidays or paid sick leave or anything that would be nice, but they paid enough to sort of like pay the bills, and they were the right fit. And then got the job that I have now, which is I've been at for 7 years and is really great. So,
Can I add one more thing? Don't be afraid to reach out to your networks, and that could be your friends, your family, your former coworkers, your former supervisors, current students, faculty, anyone, and don't be afraid to do it. When I got laid off, it was really scary, but what I ended up doing was writing an email basically saying, hey everyone, this is what I'm looking to do, here's my resume. If you know of any jobs openings, please let me know. If you know of anyone I should talk to, please let me know. And I emailed that to 100 people and just sent out a giant email. And you would be surprised. Some of these people I hadn't talked to in over a year, some people 3 years. People reached out. People want to help you. And so I got connected with other folks. I was able to get interviews through that method. And if anything, it just helped me figure out like what I wanted to do in that, in my career shift. So don't be afraid to reach out.
So we're at time, and that was such a great piece of advice, Elizabeth, that I want to give everyone one more chance to give a final word of advice to the students here as they're trying to figure out, you know, Berkeley or not, or maybe you've already decided on Berkeley, but one final piece of advice for the audience before we close out. And Jackie, I'll have you start. We'll go this way.
That's hard. You already did a hard part. You already got in. And you're here and you're present and you're already learning about what's going to fit best for you. So listen to, I think, the tiny voice in the back of your head or your heart and figure out where do you want to be, where do you want to live, and how that might support you the best way possible. Maybe it's not here. Hopefully it is. We're biased. But really take the time, ask the scary questions, get the scary answers, and hopefully you find the right fit for you, because it's definitely out there. And it doesn't have to be the perfect fit. You're not going to find 100% fit, but get real close.
My piece of advice is probably just like have fun, like kind of follow your heart. Sounds kind of wishy-washy, but like, you know, I never thought I would be, you know, a programmer now. If you asked me that, you know, a couple years ago, but I just kept on following things that I thought sounded cool, and it kind of ended up here. You know, don't be afraid to take risks, but also, you know, take care of yourself.
I don't think I have anything else.
Okay, that's okay. Well, thank you all so much for being here. Let's give a round of applause to our alum.